Welcome, everybody. This is CJ Wolf with Healthicity. And today I wanted to share some information with you about the new OIG special fraud alert on purported telemedicine companies. So there's been a lot of enforcement around some telemedicine fraud recently, and the OIG has issued a special fraud alert. As I mentioned, my name is CJ Wolf, and I just wanted to walk you through some of the highlights of the special fraud alert today. To begin, let's just talk about special fraud alerts in general. You know, the OIG does not issue special fraud alerts very frequently. In fact, in the last, I believe it's 28 years, so I think the first special fraud alert that they issued was in 1994. And actually, in that issue, when they issued that, there was multiple different topics, but it was one publication or one announcement. So since that time in 1994, 28 years, I think they've only had 12 instances where they've actually published a special fraud alert on 12 different times. So they're pretty rare. So as you can see on the slide here, in July 20th of 2022, they've issued this special fraud alert titled OIG alerts practitioners to exercise caution when entering into arrangements with purported telemedicine companies. And I guess that's to differentiate between some legitimate telemedicine. Of course, that's a legitimate service. It's good. It helps people and can be real benefit to people in healthcare. But some people also can take advantage of telemedicine as a new avenue to be fraud, waste, and abuse. So here's just kind of the cover of this July 2022 special fraud alert. We're going to dive into this in a minute, but they began by talking about how they've had lots of investigations recently of fraud schemes involving these telehealth, telemedicine, telemarketing services, and collectively they're calling that telemedicine companies. This is specifically what they said. They said, the Office of Inspector General has conducted dozens of investigations of fraud schemes involving companies that purported to provide telehealth, telemedicine, or telemarketing services and exploited the growing acceptance and use of telehealth. A lot of us know that this has been a booming type of service, especially since the public health emergency and the pandemic. A lot of services were provided through telehealth, and thank goodness, right? It can really benefit, especially in an infectious pandemic type of scenario. But with any new service, you get some people who will take advantage. So that's why I believe the OIG has issued this. Now, here are some of the main concerns, and then I'm going to share with you some of their recent enforcement, and then we'll dive deeper into the special fraud alert. They specifically said that these arrangements that these telemedicine companies get into with providers, so clinicians, physicians, nurse practitioners, et cetera, these arrangements, the companies pay practitioners in exchange for something. And what is the exchange? And it's in exchange for ordering or prescribing items or services. Doctors and practitioners do that all the time. Normally they see the patient, right? And they're examining the patient and they decide, oh, you need this service, that device, this drug, whatever. But the issue with this is they said that these companies are paying practitioners in exchange for these orders for purported patients with whom the practitioners have limited, if any, interaction. So if I'm a physician or a nurse practitioner and I'm ordering something, you would hope that there would be some sort of appropriate review of the circumstances, meaning the patient and their complaint or their concerns, and that it's medically necessary to order that. And that's number two, that the claims here that these are being done without regard, these orders are being written without regard to the service or the product being medically necessary. Now, they also point out that these payments they're not called bribes, right? No one says, hey, I'm going to bribe you. They say, oh, we're going to do a payment. And sometimes these are described as payment per review or payment per audit or per consult or per assessment, medical charts, that sort of thing. And so you kind of have to be wary, are you writing an order, but you've never seen or examined the patient? So let me share with you three scenarios that the OIG shared of recent examples of enforcement in this area. This first one was a Georgia nurse practitioner who was convicted after, I believe, a 2-day trial. Yeah, a 2-day trial found her guilty of healthcare fraud. And she could face up to 10 years in prison for each count of healthcare fraud. So pretty significant. The allegations in the trial revolved around this nurse practitioner profiting by signing unnecessary orders for orthotic braces for patients that she never examined or even spoke to. That should be kind of a red flag. If you're never seen or examining the patient, now there may be times when it's appropriate, but that should be at least be a flag and kind of make you stop and think. The nurse practitioner also facilitated orders for more than 3,000 of these orthotic braces, and that those orders generated more than $3 million in fraudulent or excessive charges to Medicare. Now, she didn't do this alone. There were some co-conspirators, and these co-conspirators captured the identities of senior citizens who were identified through a telemarketing scheme. So senior citizens can be especially vulnerable, especially with telemarketers and those sorts of things. And those telemarketers then bundled that information as quote unquote leads. So these are leads. And then the physician would sign her name to these fake medical records, essentially, in which she falsely claimed that she provided examinations of those patients. Then would the nurse practitioner created orders for orthotic braces for patients she never met or spoke with. And they gave a couple examples. One was an order for a knee brace when the patient was an amputee and didn't have a full knee, and a back brace for a patient who was recently deceased. So that doesn't make sense either, right? And also some other durable medical equipment, and all of this in exchange for money. And these orders that the nurse practitioner wrote were then sold to companies that would generate reimbursement from Medicare for these services. And as I mentioned, the nurse practitioner was found guilty at trial. The second one that I wanted to share, this is called the Happy Clickers investigation. And I'll explain what that means. These were some Michigan medical practitioners who also were involved in some telemedicine fraud schemes. And the medical practitioners would sign off on, again, illegitimate orders for medical braces, but also what was added in this case was cancer genetic testing that was promoted by telemarketers. Now, they called this ongoing investigation Operation Happy Clickers. And the reason they called it that was to reflect many of the clinicians' habits of approving these orders with little to no review. So they were very quick clicks of the mouse, computer mouse, and that would lead to them ordering something. And so Happy Clickers is why it was called. And this resolved allegations that the fraud losses were over 7.3 million to the Medicare program. Now, the first individual in this one was, I'm sorry, I should take a step back. It was marketers that would call Medicare beneficiaries. So that's similar to the last case. There was some marketing going on. And in this particular case, it was through some overseas call centers. And they solicited essentially these patients for medically unnecessary braces and cancer genetic testing for screening purposes. And just think, you get a call, you're an elderly person, and somebody says, oh, you probably need a brace, or, did you know you can get genetic screening to make sure you don't have cancer? And, you can see how this could be done in an unethical way. And in this particular case, then the marketers they'd go through locum tenens companies, and they would pay these medical clinicians to purportedly review and then sign orders under the guise of telemedicine, and then sold those signed orders to the owners of the DME companies, these durable medical equipment supply companies, and laboratories, because the labs would do the genetic testing. And that was obviously a violation of federal anti-kickback statutes. And so a nurse practitioner was involved here, as well as some doctors. Let me talk about the nurse practitioner first. He pled guilty that he signed orders for these braces and genetic cancer genetic testing, and said that he verified that the orders originally, when he did the orders, he was verifying that the orders were reasonable and medically necessary, when in fact they weren't. They often were written orders without even reviewing the medical records. But when he did do some medical record reviews, he admitted that in a 1-week time period, he signed approximately 335 separate single patient files, many containing multiple types of braces, spending on average 18 seconds 18 seconds from the time he opened the record to the time he clicked and executed the order. Um, and this nurse practitioner continued to approve these orders even after an investigator for a health insurer warned him that the patient referrals were the result of this aggressive telemarketing. In this particular case, the plea agreement, he admitted that Medicare paid over 5.7 million for these orders. Now, there were some doctors involved in this particular scenario as well. Now, these doctors resolved the allegations civilly, so they paid fines or paid civil settlements, I should say, to settle the allegations. And similar allegations, that was alleged that the physicians would approve orders for medically unnecessary braces in this cancer genetic testing, despite red flags that the items and services were illegitimate. There were often recorded phone calls between the overseas call center and the Medicare beneficiaries. And it was suggested that if the physician just had listened to those calls, they could see that these were unnecessary. And then the physicians were pressured to not deny claims. So these doctors, there were 3 different doctors involved, and one settled for over 300,000, another for 42,000, and another for 28,000. And the key take-home message, I think, on this is that, Medicare generally does not cover genetic testing solely for the purpose of screening for cancer. And so in general, those types of tests are not going to be covered. And so just to be ordering them and saying that there's a reason is not appropriate. Now, the last enforcement example I wanted to share, and then we'll dive a little bit deeper into the special fraud alert, but I'm sharing these because these are from the special fraud alert. These are examples that they cite in the special fraud alert of these telemedicine companies, committing fraud, waste, and abuse. So the last one that I want to share are some Montana nurse practitioners. There were 2 of them, and they admitted to this telemedicine scheme that affected Medicare dollars of more than 18 million. They're both in Montana. They pleaded guilty. The one faces, or each of them face up to 10 years in prison and a $250,000 fine. They have not been sentenced quite yet, I don't believe. In the 2 practitioners scenarios, the first one was that the one practitioner worked with a staffing and telemedicine company to commit healthcare fraud and received money to sign brace orders again, that were the orders themselves were prepared by the telemarketers who had no medical training or certification. And then the nurse practitioner would just routinely sign these orders for Medicare beneficiaries, regardless of the medical necessity. This first nurse practitioner signed approximately 7,673 brace orders. It's a lot of orders, which resulted in about 8.3 million billed to Medicare, of which Medicare paid about half, about 4.3 million. And the nurse practitioner himself was paid about $94,000 for all the orders he signed. The other nurse practitioner, the allegations were very similar, that he received money to sign unnecessary brace orders when it was not medically necessary, often without ever talking to the Medicare beneficiary to determine whether the braces were medically necessary. He signed over 7,000 brace orders, which resulted in about $10 million billed to Medicare, of which, again, about half, about 5.05 million was paid. And this nurse practitioner received about $125,000 for the orders he signed. So you can see why, with these types of cases, the OIG might issue a special fraud alert. And the special fraud alert begins by giving that background that I just gave to you. But then it goes on to focus on what the OIG calls suspect characteristics. So these are basically red flags. So if you're involved with if you're a provider or hospital system or any kind of healthcare provider that is involved in telemedicine, most of it that's being done is probably appropriate and good, but you got to be aware of some shady scenarios. And these are some of the characteristics. This slide and the next slide I'll share are some of the characteristics that should raise a red flag in your mind. and maybe you should think about it and look into it a little bit more. The first one is that if patients are identified or recruited by some sort of telemarketing company, like or a sales agent or some recruiter, or maybe a call center, or through internet and television or social media advertising, and it's for some free or low out-of-pocket cost item or service. So that's the enticement to get the Medicare beneficiaries or somebody, it doesn't always have to be Medicare, to get the patients interested. Oh, I can get this free brace or low cost brace or free cancer screening, or those things, in and of itself might not be automatically inappropriate, but you should look into that a little bit. The second characteristic is they said that if there's a lack of contact with the patient, that I think is kind of a no-brainer, but for some reason it's being done. You're a provider that can write an order for a certain service or device. If you haven't had contact with the patient and you haven't been able to meaningfully assess whether it's medically necessary for that individual patient, that should raise a red flag. Also, another red flag is if clinicians are compensated based on the volume of items or services ordered or the volume of medical records reviewed. So, hey, if you complete 1,000 by this time, you'll get this. Or if you complete 100 this week, you'll get this. So that volume of items and services is an issue. And then on this next slide, these are some additional suspect characteristics that the telemedicine company only furnishes items and services for federal healthcare program beneficiaries and does not accept insurance from any other payer. So if only one insurance, is like, oh no, I don't take that insurance, we're just going to take Medicare, that is a little suspect. You better think about that. The telemedicine company claims to only furnish items and services to individuals who are not federal healthcare program beneficiaries, but may in fact bill those federal healthcare programs. So they might say we don't do this for Medicare, but then they behind the scenes actually do. That should be something that's suspect. And then the last one is the telemedicine company only furnishes one product or a single class of products, such as durable medical equipment, or maybe all they do is genetic testing, or all they do is this one thing, a prescription cream or something. That's that potentially restricts the clinician in their treating options. If the clinician only has one thing that they can choose, there's not much independent thought and medical decision-making going on there. Excuse me. In other words, it's kind of a predetermined course of treatment based off of what is available for the physician or clinician to prescribe or order. Those are some of the key suspect characteristics that are in the special fraud alert. So just to kind of summarize, we've reviewed the fact that special fraud alerts are pretty rare. And here's a new one. So that in and of itself should make us pause and pay attention. And then I shared three examples of telemedicine fraud or abuse. Those are three examples that the special fraud alert itself cited. And then we spent some time on these suspect characteristics. So that's kind of the special fraud alert in a nutshell. Of course, you should read it yourself, but hopefully this gives you a nice overview. Appreciate you listening. If you have questions or want to engage on this topic or even other topics, feel free to reach out to us at the Healthicity blog. And people are asking questions and getting answers all the time on that site. So thanks for listening and happy compliance to you.